The New Jersey Center for Tourette Syndrome and Associated Disorders, NJCTS, and its directors and employees assume no responsibility for the accuracy, completeness, objectivity, or usefulness of the information presented on our site. We do not endorse any recommendation or opinion made by any member or physician, nor do we advocate for any treatment. You are responsible for your own medical decisions. Now, I'm going to turn over the introduction of our speaker to Martha Butterfield, the webinar coordinator of NJCTS. Marty?
Kelly, thank you, and good evening, everyone. Welcome to tonight's webinar. Before I introduce our presenter, I'd like to call your attention to the slide on your screen about the upcoming scholarship deadline. Our scholarships are awarded to graduating seniors diagnosed with Tourette syndrome who are going on to either 2- or 4-year colleges, and these scholarships apply to New Jersey residents. The application is available on our website and is due with all of the required information in our office by April 21st. Now to the introduction of our presenter, Dr. Graham Hartke. This is Dr. Hartke's 5th webinar in our Wednesday night series. He has presented on how to get your child motivated for school, what parents should know about cyber safety, internet social skills, and lastly, on anxiety and its impact on sports. All of those presentations are available for free download on our website. Dr. Hartke is an authentic Jersey guy, a graduate of Rutgers University, where he also received his graduate degree from the Rutgers Graduate School of Applied and Professional Psychology, with a doctorate in school psychology and a concentration in sport psychology. He is a licensed psychologist in private practice in Roseland, New Jersey. While at Rutgers, he was selected to work with TS children and families as a clinician in the Rutgers Tourette Syndrome Clinic. He is also a New Jersey certified school psychologist serving in that capacity at Shepherd Schools in Morristown, New Jersey. He specializes in anxiety disorders, OCD, Tourette syndrome, behavioral management, attention deficit, ODD, high-functioning autism and Asperger's syndrome, and mental coaching for sport and performing arts, working with children, adolescents, and adults. Dr. Hartke, welcome. It's great to have you back. And now, without further introduction, I'm happy to turn tonight's programming over to you.
Thank you, Marty and Kelly, for that very nice introduction. And also I'd like to thank Faith Rice and everyone at NJCTS for having me on again tonight for another webinar. And to all tonight's participants, I welcome you, and I'm happy to be here. Tonight's topic is a very relevant topic to many people. And I believe that, I've been talking to Marty for a while, that this is a topic that we've been trying to get on as a webinar for quite some time, so I'm happy to finally give this presentation tonight and kind of get the topic, out there for the NJCTS community. Okay, so tonight's topic is challenges and strategies to help positive development of siblings who have siblings with special needs children. The overview of today's presentation is as follows. First, we're going to cover sibling relationships, some general information, some research, and some commonalities in sibling relationships. Next, we'll go over challenges that siblings of children with special needs face. Then we're going to have some strategies, go over some strategies to help these siblings. And finally, we'll cover a few resources. I just want to say right at the beginning, but this webinar refers to special needs broadly. This is not a specific presentation about siblings of children with Tourette syndrome or autism or Down syndrome. This is meant to be a broad-based discussion and webinar. So it's just generally covering the challenges. Also, I'd like to always say at the beginning of every webinar that this is, a webinar that has, just some information to get everyone acquainted with the topic, and it's not a really super in-depth review, but there are some resources at the end that if you'd like to learn more about it. So let's look at sibling relationships. Worldwide, statistics show about 80 to 90% of children have a sibling. So that's a large amount. It's also one of the most long-lasting, enduring relationships. Most siblings know each other from birth until death, until one was born, or the, but it's really a relationship that lasts usually the entire lifespan. And usually children spend much more time with a sibling than they do with anyone else growing up. Moving to the next slide, we really want to cover the idea that the sibling relationship is very key to each child's development. So growing up with a sibling, the relationship you have with your sibling really defines much of how you develop and the skills you acquire as you get older. Looking at from an attachment perspective, a positive, secure sibling attachment, so one filled with warmth and connection, really helps with positive development and self-image. A negative, unsecure attachment really leaves kids a little bit more at risk to have a less trustful view of the world and struggle with internal and external problems. So anxiety, acting out, depression. Also looking at it from a social learning perspective is the idea that, growing up together, siblings spend a lot of time observing and learning from each other and modeling each other's behaviors. And often these behaviors generalize to the outside world. So siblings often learn how to interact with others a great deal from their interactions with each other, and that generalizes outside the home. It's also related to that, siblings really learn how to resolve conflicts and manage feelings that come up in times of conflict. So feelings that are really common sometimes are jealousy, anger, but also feelings of trust and warmth and sharing. So indirectly and directly, sibling relationships have an effect on development. They affect the behavior, learning, all the way down to social problem solving, stress, and mood management. It really also could have a big effect on the areas in the middle, social skills and relationships. And a lot of relationships that siblings form with each other really are models for relationships that they're going to form later on in life with peers and, as they get older, with more intimate relationships. Just being close with people, living in close quarters, a lot of that groundwork starts with siblings. But when you think about siblings, you think about a lot of words that come up when you think about sibling relationships. And this presentation really is not meant to just cover negative aspects of sibling relationships, because that's not the reality. They're often filled with a lot of love, companionship, support, loyalty, rivalry, of course, and definitely there's a sense of friendship in a lot of sibling relationships. Even siblings that would tell you that they don't really like each other, often they're kind of each other's best friends. And this also definitely changes throughout the lifespan. And on the bottom, I wanted to also highlight that in the sibling relationships, there's often a power dynamic going on. It's either perceived or real. Often the older sibling, especially in the early years, has a little bit more power. In a relationship where some siblings have special needs, it could be, roles could be definitely reversed. This could be the younger sibling if they have less special needs than the older sibling. But definitely it plays a role in the relationship as well. But some really key areas of sibling relationships are the ideas of fairness, okay, and the idea of what is fair in the sibling relationship. So are they getting a fair amount of attention, access to resources, and are they getting different treatment from parents, which happens basically without question in almost every sibling situation, is that there's no way parents can treat every sibling exactly the same. But it begs the question, is fair always equal? And this is a really important issue to bring up with children. And this really has to do with the needs of the kids in the situation and really creating a level playing field. And, having some kind of rules, and if people are playing by the same kind of rules. For example, bedtime for a 9-year-old is not going to be equal to the bedtime for a teenager, but they both could be fair in that they're appropriate for their age and following the rules of the house. There might be a tutor that a family gets for a learning disabled child, but the other child doesn't have a tutor because they don't have the learning disabilities. So while the one child might think it's not equal, it can be definitely fair if it levels the playing field. Also, another huge aspect of sibling relationship is sharing, managing conflicts, and helping. So all these areas are really important to cover and keep in mind when you think about sibling relationships. These are four very key areas of development that children learn about and experience on a daily basis with their siblings. So just to cover some research in this area as we move forward, there was a meta-analysis done recently which really is a study that looks at many, many studies of the same topic, and they wanted to kind of take the data on sibling relationships and find some patterns. And they really looked at how sibling relationships lead to internalizing and externalizing problems. And internalizing problems are things like anxiety and depression. Externalizing problems are things like acting out and behaviors that you can see. So what they found was most studies on sibling relationships cover three main areas. They look at warmth in the sibling relationship, so areas like intimacy, companionship. They also look at conflict and differential treatment. So conflict really covers areas that you think it would go along with, but specifically fighting, hostility, and even just aggressive behaviors. And differential treatment, really what they're looking at is how the siblings perceive differential treatment, or in some studies, how the parents perceive differential treatment. Because that's really something that's perceived. Sometimes it can be very, clear cut. One kid gets one M&M, the other kid gets two M&Ms. But usually the important piece here is how it's perceived by everybody. So findings looking at many studies have showed that more warmth is linked to less internal and external problems. So the warmer the relationship is between the two or more siblings, less problems. More conflicts linked to more problems, and more differential treatment is linked to more problems. And I'll say this again about differential treatment is that it's unavoidable, and so it definitely happens in every household. We'll talk about a little bit more of how to address that, but it is not something that is uncommon, and it basically happens all the time. A couple of interesting findings on these areas I just thought I'd bring up because is that actually in some cases warmth between siblings is linked with more acting out behavior. This is typically in clinical samples, so cases where there's a history of aggression or acting out. You can kind of think of it as, maybe there's an older sibling who gets in trouble a lot, acts out a lot, but he's got a really close relationship with his brother. The brother imitates him, also gets in trouble. This typically occurs with boys. It's just something that came up in research studies that warmth can have this effect, but most of the time, almost 99% of the time or a little bit less, if it's not a clinical sample, warmth leads to less problems. So if the siblings are close, that's good. With conflict, if there's too much conflict, it can generalize outside the family, and siblings can grow up with less empathy towards others. So if you're thinking about it, if siblings are constantly fighting all the time, it'll generalize outside the home where they'll stop, taking others' perspective as much and thinking that they always have to fight for everything they need. Can lead to behavior problems. Now, this doesn't occur in every situation, but this is just, what the research shows and in many situations occurs. And differential treatment. It's important that parents are aware of this, and most parents are very aware of this and some feel guilty about it, or some just, it's just an added layer of stress. But it's the kind of thing where, there can be improvement if parents make small changes and try to address it. But knowing that it is unavoidable. In some cases, kids may act out to get parents' attention if they feel like they're giving too much attention to one sibling or another. You might start seeing withdrawal behaviors, which can get the parents' attention because they'll want to come over and ask, "Are you okay?" There was a situation where I know one family where a sibling had a special need, and The sibling without special needs was deciding to just every day kind of destroy his room. It was a younger child, and the parents were getting very frustrated with the sibling. But when the parents started giving the sibling a little bit more attention, just a little bit, and the behavior stopped. So sometimes kids will act out in ways, and it doesn't always come out directly where they tell you, I feel like I need more of your attention, but they'll show it in other ways. So another huge area to bring up here before we get into the challenges of siblings of children with special needs is just looking at family factors and how that really plays into sibling relationships, because this is a huge, huge piece. So the relationships in the family, but is there harmony? Is there stress? Do people communicate with each other? How is that communication? Is it open, or is it kind of shut down and just a lot of yelling and arguing? What is going on in the home? So the relationships with the parents. Are parents married? Is there a single parent household? Divorced parents, step parents, guardians? Those are all factors. Marital discord is linked to more sibling conflict. It's also interesting to look at parent relationship with each sibling and siblings' relationships with each other. So a firstborn sibling often has feelings of jealousy, especially early on when they have younger siblings enter the family. Later born siblings often experience some jealousy when older siblings are able to do things, first, or they get to, access to more freedoms as they get older. These are just natural parts of the relationship. Also, are there step siblings involved? How many siblings are in the family? Extended family relationships could be either a huge factor or not much of a factor in certain families, with as an area of support or stress. And these are just all the things to consider in families. I do want to point out that certain things in sibling relationships play a big role, and some of them can be very small, and parents usually are aware of these things. But for example, where does the family live, and specifically what kind of living space are the siblings co-inhabiting? Are they sharing a room? Are they sharing a bathroom? Are they do they have to do their homework at the same using the same desk? Really, these are important aspects of the sibling relationship that are often not looked at first, but really can lead to some helpful interventions if there is some stress in the family, of looking at how these things could be adjusted. One thing on the bottom I want to point out about socioeconomic status is that there was a pretty big study in Australia where they have a lot of data on the children in that country, and they found out that when they looked at siblings who have children with special needs, that when they factored in socioeconomic status of the family, that the difference between siblings who had siblings without special needs and siblings who had siblings with special needs. So kids growing up in a house where no one has special needs, or kids growing up in a house where at least one person has special need, a lot of the challenges with the special needs households were vanished with the research when they looked at socioeconomic status. So what that really highlights is that where the siblings are living, regardless of what the challenges are individually, really could play a big factor, and it's just some things to consider in any relationship. Okay, so the take-home point is that there are many factors influencing sibling relationships, and they're very important to development. So let's move forward to looking at specifically siblings of children with special needs and their challenges. Okay, so here I want to just define what we're talking about is a child or adolescent who has a sibling with special needs, okay? And this child may or may not have their own special needs. So I'm not referring to them as a typical and normal child. Every child is unique, and often in families there could be multiple children with different levels of special needs. So I don't want to generalize and make it seem that every family has two children and one child is normal, one child has special needs. What I'm referring to is that every child's unique, but we're really talking about the sibling in this case who maybe, if they have some special needs, it's not as severe, or they have no special needs, just to kind of contrast a little bit. But children grow up in households, and every household is different. The sibling with special needs in this case, like I spoke about in the beginning, might have a disability that is chronic or acute. So it could be something that's lifelong or long-lasting, or it could be something that's just short-term and will go away. So, and we're talking about all kinds of disabilities or special needs, so physical, mental, behavioral, social, emotional, learning-based, anything else you could think of in this case. Okay, so let's start off with some positive impacts for a sibling of child with special needs. This is often something that's really highlighted a lot, and in the helping profession, a lot of people who go into human services fields such as teaching, mental health, healthcare, anything in that area, a lot of times if you talk to them, they grew up in a family where someone had some kind of special need, and it really led them to become the person they are and gave them a sense of purpose in life, and it really impacted a lot of their development. So this is not a, usually this could be a very positive experience for many people, but so let's look at the positive impacts. It can foster the development of a very responsible child. This child who's very responsible often could be the helper for the parents. Like I said, it could be the older child, or in some cases it could be the younger child, depending on the situation. But they could really just step up and become, show a higher level of maturity and really help out doing chores, asking if mom or dad needs anything, and really kind of helps develop a sense of loyalty to the sibling and the family. So in this case, it really helps develop social emotional skills. So things we talk about that are really important for emotional intelligence, empathy for others, taking others' perspectives, being able to delay gratification, have patience, having a sense of resiliency, so overcoming obstacles, getting through challenges, and really knowing how to solve problems and decision making. So, I know a sibling, for example, that has, I believe, a sister who's older with Tourette syndrome, and recently was struggling because they were out in public, and the sibling's tics were really getting very noticeable and loud, and the sibling was banging on the table at the restaurant they were at, and the sibling went right into action and figured out a way to put a napkin under the table where one sibling was hitting, and kind of distracted the sibling, got an iPad out, and really just stepped into the role where they're trying to solve the problem and help the sibling out and manage the situation. So a lot of times these siblings could really be a primary, in a way, source of support for their sibling, and in a sense they develop a real strong sense of empathy and an ability to problem solve in the moment. So let's look at some challenges now, because I know that's what a lot of the focus is on. And there are some real challenges that these children and teens face. Social emotional stress. So all these things come up, especially at different ages. Kids might experience different emotions. A teenager might all of a sudden, who've never thought about their sibling, might become embarrassed, when their sibling enters their school in high school or middle school. They might become very worried about their sibling, especially if there's some real serious health issues going on, and that could cause a lot of stress for them. There could be jealousy and anger surrounding, feeling that they're not, things aren't fair or not equal, a sense of guilt that they don't have the condition themselves, and oftentimes, these children will sometimes withdraw and experience some depression if things can get really tough in the family. And I do want to point out here that a lot of these factors are just unique to different individuals. So not everyone experiences these, and these definitely can change over time. So there might be a really challenging time in a family's history where one sibling's really going through a rough spot, and so these feelings could come out, but after a few months things just get better and it never happens again. So it's not that these emotions, they occur for years, forever. Everyone's different. Some other challenges. Obviously, special needs children place a lot of stress on family resources. So money, time, attention. It really puts a lot of stress on the parental resources. So having to take care of the child, run a household, manage the other siblings, often work a job, and split duties with the other parent, involve extended family and babysitters and going to doctors. There's a lot of stress. Differential parenting or treatment is just part of the package. these children often find themselves evaluating if things are fair or not. Was this fair? Is this not fair? And even if they know what's going on with the other sibling, it could really, deep down, it could just bother them if they feel like things aren't fair. Often there's pressure to be the perfect child, or what Alice Miller called in her book from, I think, came out in the 70s, the gifted child can develop, which is really the child who, like I talked about in the other slide, is the helper child who really steps in. But this child kind of takes it to another level where they take on too much responsibility in their mind, and they feel like they have too much responsibility to make sure the house is calm and that things are in order, and this could really cause a lot of stress for that child. And also, challenges are social learning and conflict. So one thing that comes up a lot with families I work with are siblings who don't have special needs imitating their siblings who have special needs. It happens a lot with Tourette syndrome, but it could happen with autism or any other condition where a younger sibling, for example, sees their older sibling with special needs, let's say throwing their food at dinner, and the younger sibling just starts to do that. Or an older sibling or younger sibling who has oppositional behavior is really just defying the parents and causing a scene. And the older sibling might just, who's even older and mature, might imitate that behavior a little bit to see if they can get away with it. So sometimes it's a real problem that families experience, is the imitating behaviors. There's obviously the conflict and rivalry that comes with any sibling relationship, but it can be magnified in these relationships with the stresses that occur. The sibling without special needs could feel like they are kind of literally fighting for resources that might seem scarce to them, which mean attention and access to their parents' ability to take them places, and just even a sense of a calm, peaceful house. In some cases, particularly when siblings with special needs have more anger issues or acting out, it can lead to physical aggression or abuse, which does occur sometimes if kids have rage attacks or other challenges in those areas. Okay? And often acting out to get attention occurs when children are not feeling that they're getting the attention they want from the parents. Okay, so we're going to move along. All right, so studies about children with special needs have found that they have about a 60% increased risk for internalizing and externalizing behavior problems. So this includes these areas. And we talked about these before, but really it definitely increases the risk that it could occur, but it does not mean it's definitely going to occur, because there are many factors, like we talked about before, involved with all these relationships. Okay. So some things that that kind of are related to children differing in how they respond. Obviously, children respond differently over time. So younger children tend to act out more than use more words. Older children and teens who don't have special needs tend to become more understanding, empathic, and just start to have better relationships with their siblings as they get older. So with age, it usually helps out. And sometimes you just have completely opposite reactions to a challenging situation. So a sibling of a child with special needs, one might be extremely compliant and helpful, and the other might be defiant. So the children just differ naturally. Every sibling relationship is unique. Okay. So here are just some variables. The type of disability can influence it, severity of disability, age of children, closer in age. So siblings that are closer in age tend to have a little bit more conflict. And as they get older, typically have a better adjustment in relationship. Environmental factors we talked about, social economic status, and families' routines also could play a big role. What I see a lot in families I work with are actually sports play cause a lot of trouble for some of these siblings, because a lot of times a sibling without special needs might be involved in a lot of sports, and takes up a lot of time on their weekends, or would like to do that, and the sibling with special needs might be involved in some kind of activities as well, but they might be different activities, and it just often causes a lot of family stress with scheduling activities, getting to those events. Often one sibling can't go to something they want to go to because of the other sibling, and that's a really important variable for affecting these relationships, is how the family schedule is set up. And also, certain kids are just more resilient. They have just a different kind of personality. There are different cultural aspects. Some families are just, they live in big extended families where everyone kind of takes care of each other. Some family cultures are to kind of really embrace and accept a child with special needs. Others just have a family culture where it's more you don't want to talk about it. No one wants to, no one even tell their grandparents about this child with special needs. So every family has their own dynamics and culture at play. So just some notes on specific conditions or disabilities. Now these are general, okay, and a lot of them apply to multiple. But with Tourette syndrome, it's really key that a sibling without Tourette's has a good understanding of what's going on. It can be very confusing for them to be around tics and other associated behaviors like OCD. So communicating with that child can really go a long way and helping them understand and just respond better and learn about what's going on. In situations where there's OCD, often studies have found that siblings who don't have OCD are often involved in the rituals and the compulsions. So that's just a factor that sometimes is there. Siblings might be, and the rest of the family might be entwined in a lot of the rituals. With anxiety and depression, which is internal, a lot of times siblings who don't have anxiety and depression are not really aware of what's going on as much as they might with Tourette syndrome or OCD, that they could see more usually. OCD sometimes could be hidden as well, but I'm just talking in general. And OCD is a type of anxiety. But generally, siblings experience anxiety and depression siblings as irritating if they don't have them. They just will report that their siblings really bothering them. They're irritating them. Why are they always withdrawing or hiding or causing a whole scene? So you might get responses like that for siblings that don't have those conditions. So with learning disabilities, most siblings who don't have learning disabilities are patient. Parents sometimes can feel guilty about spending more time with one child than another, particularly with working on homework. This happens, I hear this a lot. Sometimes there's teasing that goes on where one sibling might tease the other for not getting a concept. So you could have an older sibling with a learning disability and the younger sibling who doesn't, and the younger sibling is 3 grades below that sibling and they're reading at a way higher level, and sometimes there could be some teasing or embarrassment at play. So with these other areas, autism, research has shown that sometimes because of the nature of autism, that there's they find less warmth between siblings. So a sibling who doesn't have autism with a sibling that has autism, or multiple siblings who have autism, sometimes there's less warmth. It has to do with the social difficulties of someone with autism. Down syndrome, often it's found there's less conflict between siblings. For a sibling that doesn't have Down syndrome and one that does, and a more positive relationship. And in situations where there's anger difficulties and rage, I point these out because these come up a lot in my work with families, is that this can be very disruptive, and often the sibling without these disabilities can be very scared, particularly if the other sibling is more powerful, either perceived or real. And if this continues for a long time, where a lot of there's anger outbursts that are directed at the sibling, they almost start withdrawing and kind of develop a sense of learned helplessness, meaning that they just have learned that there's nothing they can do to stop it, and that and they start having their own problems with withdrawing and anxiety. So that doesn't happen all the time, but that's a real serious one to address. Okay, so siblings of children with special needs, here's some strategies to help. So really I want to look first, what is the goal of any kind of strategy to help siblings of children with special needs? What are some general goals? And I have 3 goals. One is you want to increase positive interactions. You want to increase warmth between the siblings and decrease conflict. 2, you want to increase positive life experiences for the sibling without special needs. So they need to have the attention that they need. They need to have perceive that there's a fair environment they live in, have a better understanding of what's going on with their sibling, have open communication with their parents about it, and just a sense of that there's a little bit of stress reduction. That's the goal. And the 3rd goal is to increase positive family interactions. So really working on that family piece, which is so important to the relationship of these siblings. So making adjustments to improve how the family runs. So because this is my 5th webinar in JCTS, I had to do another acronym for this and for Marty. And what we're going to use to outline the strategies is the acronym SIB Fair. Okay? So SIB Fair outlines 7 areas to address for helping children, siblings of children with special needs. So the first one is speak. Communicate with a child about their sibling. Then we have investigate. You want to ask them what they're thinking. You want to be the best family possible, manage fairness, address the sibling's needs who does not have special needs. Give the sibling their own individual experiences and model for them the positive behavior you want to see. And we're going to go into more detail. So SIB Fair, okay, we're talking about sibling fairness. So first it's to speak with the sibling. So what I think is very important and what I find sometimes is that often siblings do not, they don't really understand exactly what's going on with their sibling with special needs, and they don't really need to know everything, whatever is developmentally appropriate, but it really helps a lot of times that they have a better understanding of what's going on to help them develop their own empathy and really react differently and kind of understand the fairness piece. So you want to acknowledge all perspectives. You really want to communicate with them. This is how your sibling is feeling right now. This is what they're going through, and really, tell them what's really appropriate for them. So you might not tell a 7-year-old the same amount of information you will tell a 17-year-old, obviously. But really, it's a good place to teach them skills of how to respond also when their sibling has difficulty. So if their sibling is really struggling and it's scary for them, teach them skills to calm themselves down, where to go, a safe place. A lot of families do this already, but it's just good to point this out. And also to constantly communicate with them, to really check in that they have an understanding of what's going on. The next one is to investigate. So it's the second part of the communication, is really you want to ask the sibling how they feel and what their needs are. A lot of times these siblings feel like no one really asks them how they feel, or they really feel like their needs don't matter as much, even when they know their parents love them, but there's so much attention given to their siblings sometimes that it's really important to just listen to them. And what I have here is listen without telling them how to feel. So let them just talk. If they're telling you that their sibling is irritating and it's frustrating and you can't stand it when they try to use the bathroom but their sibling's in there doing an OCD ritual for 30 minutes, but they don't care because they want to go in there and brush their teeth, let them talk about it and listen. Okay? Telling them, no, you need to understand your sibling has trouble, that can be discussed with, letting them know about disability, but sometimes they just need a time to vent. Let their feelings be validated that, yes, I understand that can be really frustrating for you. And so just kind of talk to them and ask how they're feeling and try not to tell them how to feel. You could educate them, but that's a real, fine line there. So, I have this stuff down here. A good example, is really asking them sometimes, is it okay for them? So certain situations, is this okay for you? If right now I have to, an emergency take your brother or sister to the doctor today, but I will, make it up to you later. Is this okay for you? So sometimes just asking and checking in really makes a big difference for these children and gives them some attention. Best family possible is B. So really this is improving your family activities. So looking at areas such as the family rules, responsibilities, and kind of considering, is a sibling without special needs overburdened? Even if the parents don't feel that it is, the sibling might feel like they're taking on a lot more if, based on comparing to the social comparison with their sibling. So it's just something to address. So you might want to modify some rules, make some rules for the siblings with special needs as well that they can handle and follow, so that both siblings have things that they have to, chores they have to do or rules they have to follow. Although they might be a little bit different, they both share the commonality that they have, their own set of responsibilities they have to take care of. And really improving relationships is important. This is an understatement, and people could spend years working on these things. But sometimes if you notice your sibling who doesn't have special needs is showing a lot of stress, just a little tweak to your family schedule, spending an extra hour a week with that sibling, or doing something together as a family that's positive can really make a big difference. Some other family activities, just are good just things to kind of check on, and then any family probably strives for, but a lot of times with the realities of working and the stress of taking care of a child with special needs is hard to do, but try to schedule regular family activities, even if it's only once a week, but maybe every day, even if it's just something like a dinner or a game night. But pick something that has a good chance of being successful. So if you have a child with special needs that cannot handle, a game night, don't do a game night. But find something that everyone can do together, and it could be done in parallel, where everyone is not really interacting too much, but everyone's kind of reading together and doing an activity in the same room, or it could be done together. But really, just finding family activities and things to do together, improving on that is important. And this is an area I'd like to just bring up, is that especially with families that have children with special needs, is really consider asking for help if you need it. A lot of times, extended family is right there helping out, our friends of the family, or there's other support services. But sometimes I've noticed in my experiences that it really, it's an area that's really lacking. Sometimes families don't really want to reach out to extended families for whatever reason, but it could be an area of support. Single parents often have a really tough time managing all these resources, and it can be very stressful. So reaching out is extremely important. I just wanted to highlight that there. And obviously there's therapeutic services that many people already take part in, but there's family therapy, there's at-home behavioral therapy, there's all kinds of different services that are out there, depending on your specific need. Okay, so next is fairness. This is the really big one for a lot of conditions, is managing how the children perceive fairness. So chores and household tasks should be evenly divided as much as practical. Come up with something that you can work out, where maybe there's something easy that each child can do, and then there's something that's a little more tricky, but they at least are both doing something, if possible, or try to strive for that. Parents can track how much attention they give to one child or the other, whether it's in their mind or on their iPhone or Android or some other way, but just kind of keep track of, in your mind, like, I really spent a lot of time more time than usual with my child with special needs, but child without special needs, I'm going to, I need to really make that up this weekend, maybe find some way to do that. One example is when one child's at the doctor, another parent can go take the other sibling somewhere. Try not to play favorites. It's easier said than done, but I'm just putting it on there. And something that some parents use sometimes is for like chores or different activities, is to create a behavior chart, and it can really reinforce a sibling without special needs for all the things they do to help out, to show fairness, is to have a chart, and both children have tasks or activities on there for chores that they can, or activities they do in the house that are both reasonable and practical that they can do. Okay, and parent splitting time, I brought that up, but that could be helpful. One thing I want to point out on the bottom is it could be important if your child really has trouble with to really explain that fair is not always equal, and explain that concept. And that fair is about the needs of the person and creating a level playing field. That, the idea is that, the sibling with special needs has a really tough time, let's say with learning, has a tough time reading. So they need more time just to even read, a few pages where you can read an entire book. So that conversation is not always easy to have with children, but it's good to put that in their head, that fair is not always equal. Doesn't mean exactly the same goes for this child as that child. It means that everyone gets what they need, and that's it creates a level playing field. So the next part is addressing the siblings' needs, which you might think that's what I've been talking about. But what I'm talking about is often siblings without special needs have their own needs. Sometimes they might be special needs. Okay, and these needs are the needs we talked about before when they have challenges that might pop up. So really, parents being aware of the signs that your child without special needs is starting to develop trouble. Often with kids with special needs, their problems are severe to a point that the family gets used to that kind of level of severity, that they might not notice that their younger child is struggling as well. I see that a lot when I work with families, that the sibling also has some difficulty in certain areas, but compared to their older sibling or older siblings, they don't really stand out as much. So addressing these needs, providing the right assistance they need when they need it, maybe some counseling in school, support. And also, if, like I said before, about if it's a relationship where the sibling rivalry is really intense and dangerous situations are occurring with fights, really it's important to obviously, stop that as much as possible and act immediately, which most people do instinctually, but I just put it on there because that's an important piece. And sometimes these fights happen when parents aren't looking a lot of times. So they'll get one child very upset and the other child, upset for a different reason. He did that, she did that. But it's important to kind of, try to find out what's going on and really stop if people are getting hurt. This is I think one of the most important and easier aspects to do if you have some time in your schedule, of way to help the sibling without special needs, is really give them their own individual experiences. And this is something that you could schedule every week, that you're going to take the child without special needs somewhere by themselves. They're going to get to go with their grandparents somewhere special, or the child with special needs will go with the grandparents, and the child without special needs will go with the parents somewhere and just do a special activity. It's not that you need to split up the siblings all the time, but the trouble is that the sibling without special needs might feel that they're really getting such a little amount of personal attention, and their own needs are not being addressed to a level that they'll really appreciate some of their own time. And important things like letting them develop friendships in the social life outside the house, letting them have experiences that are different from their other sibling. If a sibling does not want to play violin, but their older sibling does, and the parents are really pushing the younger sibling to play violin, that might be something you want to do, is let that sibling stop. Let them find their own activity. And whether that be sports or reading or just not doing an instrument, but that's an example that comes up a lot, is really giving the sibling their own special activity and time. And this should be done guilt-free, in that we don't want to make the kids feel guilty, like, well, you really should appreciate this because I could be spending time with your brother or sister. It should be done guilt-free. So last here, I have just a reminder, is to role model positive behavior for these kids, because they see the parents responding to the sibling with special needs, and that's where a lot of these siblings take their cues from, of how to respond to it. So it can be very stressful for a lot of parents, and but the other siblings are watching how and they're learning from your behaviors. So to really pay attention to how you're demonstrating these interactions. You also might want to directly role play with younger kids, how to respond to difficult situations. So that can include talking to the sibling about how they respond if someone at school asks about their older sibling or younger sibling's special needs. So, for example, there could be a child with, Down syndrome, and the sibling is going into is in high school already, who doesn't have Down syndrome, and their sibling with Down syndrome is coming into the high school, and the parents might want to sit down and talk to that sibling without Down syndrome about how to respond and how to help their sibling out in school. How to respond to a difficult situation, what to tell people. Same thing can occur with Tourette syndrome or anything else. Basic things like teaching kids how to relax. Take 5 before reacting. So they could practice. If your brother or sister really irritates you, I want you to count to 5, walk away, go to your room, go to your safe place, and just demonstrating for them how you want to handle this by showing them yourselves. And this also includes, kids are watching if you're asking for help as well. So if the kids are growing up in a house where the parents seem to always, do things on their own, never ask for assistance, if you don't need assistance, that's fine. But if you could use some assistance, the kids pay attention to things like that. If you're asking kids to ask for help and they're seeing you never ask for help, you're not modeling that behavior for them. So that's just something to think about. Not letting the anger get the best of them. That's something, kids with special needs might get their parents really angry. So trying to manage your own anger in front of them is helpful. It's hard to tell kids, don't get angry when you're getting angry as well. And things such as moving on from issues and focusing on moving forward. So when there's a conflict, or a problem, I mean, an issue with sharing. Maybe one kid is upset because the other kid hit him, and they want something. The parent, could basically ask the child, like, okay, we're going to calm down right now, and let's focus on how we can move forward, instead of kind of getting into the problem and really rehashing it, kind of addressing that they're upset and focusing on more proactive. What are we going to do now? We're going to calm down first, then we're going to apologize, then we're going to move on. But really not exaggerating or highlighting an issue and letting it labor on for a long time. And that's also collaborative problem solving is an approach I talk about a lot by psychologist Ross Green, which can be helpful, which involves a lot of empathizing with kids and really working through problems in that way with them. So here's some resources. We're going to end in a minute, but the Sibling Support Project is a really great website and organization. They have actually SIB shops, which are workshops for siblings of children with special needs. This is a screenshot from their website. So I just wanted to highlight this. They have a ton of information on this topic. They offer workshops all over the country in different states. So you can look up, I think there are a few in New Jersey. There's local groups and publications. I found on the main page there's a nice little slideshow I just wanted to highlight really quick, which shows some quotes that siblings have, of siblings of children with special needs have, given about their experiences, and a lot of them are very positive. So things like that's on the screen now. So a lot of these really show that this, in these quotes and in the activities that siblings put out there, that most siblings in these situations, especially as they get older, really reflect on the experience and grow from it. So I just wanted to show some of those slides. This is a quick example. There are a bunch of other resources out there. Through the Sibling Support Project, they have their own books they wrote on the topic that you can get on Amazon. I don't think they're expensive. If you want to give a book to the sibling without special needs, that's be helpful, but a lot of resources on this website. So siblingsupport.org. Also, the Rutgers Tourette program has had, they do groups, and usually they do a TS group of kids with TS, Tourette syndrome, then they do a group for siblings, and they do a group for parents. I was told this year by the director that it's not occurring this year, but I encourage everyone who has Tourette syndrome or in the family and is interested to reach out to the Tourette program at Rutgers. You could just Google Rutgers Tourette program. It's affiliated with NJCTS, and contact and see if they're offering any groups next year or in the fall. This link at the University of Michigan is very helpful, as well as the NYU Child Study Center has a bunch of information on the topic, and also this Parent Center Hub. Okay, and with that, Marty or Kelly, is there any questions?
There sure are. Thank you very much. Really a lot of great information. We have a little bit of time here, so I'm going to start right away. Have a question about, or from, a mom who says that her child without special needs has said that her friends at school, when she tells friends at school that her sibling has special needs, they tell her how sad that is. And the child doesn't appreciate people kind of pitying her. So do you have any suggestions on how she might respond to that?
I mean, generally my first initial reaction is that the child without special needs, I would encourage her to just model for her friends that she's okay with, it's not something she's sad about, and that and really, her friends don't really know what's going on, so they probably don't really know how to react. So I think it's a good place for the sibling, the parents can coach the sibling to really, tell her friends that, it's not something you have to be sad about. I'm not sad about it. It's really great, or whatever the situation is, and just really kind of, in that way, the sibling without special needs is kind of teaching her friends, or modeling for her friends, how to respond to it. People really respond to how others react in the situation. So if the sibling without special needs is acting like, woe is me, this is really terrible, her friends will mirror that and they'll also respond. But if she's really positive, I think she should just be upfront with them and remind them, like, no, I'm not sad about it,
Yeah, that's a
But
great
without
answer.
knowing any more information, that's all I could say.
Yeah. But that's a great answer, though. I love my siblings, so we're cool,
Right.
and just move on. So yeah, I like that. Okay, would you explain a little bit more about mood management skills? Exactly. Yeah, I know you touched on it, but talk about that a little bit.
Yeah, I mean, mood management skills are really, it's a really big topic. So basically dealing with understanding your feelings to a basic level, empathy for others, but also just really understanding how you're feeling and knowing how your feelings and thoughts are affecting your behavior. So from on a general level, it could be, looking at your thoughts, challenging your thoughts. It could be engaging in kind of relaxation activities. It could be engaging in activities that you find enjoyable, non-stressful activities. If you're prone to get really upset doing certain activities, making sure that you aren't doing those activities as much. Really just, I mean, I'm talking very generally because that's a whole other topic, but mood management just basically means if you are feeling depressed, sad, happy, or jealous, really knowing how to be aware of your mood and take actions to manage it. Whether in some situations, let's say with siblings, one sibling knows that they get furious every time their sibling takes something of theirs. So let's say the sibling has a new hairbrush and they're very excited to use it, and the other sibling always seems to take it and hide it, or they never find it, gets their hair in it, it causes a whole problem. Mood management in that situation would be the sibling is really upset, knowing how to take some deep breaths, calm down, realize that anger level is really high before they act out and do something to hurt the other sibling. So really learning the skills of how to problem solve, be aware of your own feelings, and do the behaviors that you need to do to eventually solve your problem, but not make it worse.
Good, thank you. Another question about learned helpfulness. I believe that was, so there was
helplessness.
Helplessness, sorry,
Yeah.
Helplessness, okay. So what are the potential problems for that child in that, learned helplessness situation?
Well, a lot of times learned helplessness, which is pretty big concept in psychology, in the area of it leads to a feeling of depression, a feeling that there are negative aspects of the world that are global, meaning that they happen everywhere all the time, and that they're stable, they're never going to change. And it's a kind of thinking that really could lead kids to withdraw, and sometimes develops. And you might see it in kids acting in strange ways. It could come out with some kind of nervous behaviors, or just saying they don't want to participate in things. It could start becoming fearful. So it really leads to often feelings of depression and hopelessness, but also a lot of times anxiety and stress.
So a sibling who is doing that, then is that a diagnosable kind of thing, or is this something? How would a parent observe that?
Well, it's not okay. So I think what happens is a child without special needs might feel a sense of learned helplessness if there's a lot of conflict. It doesn't always have to be in a situation with a child without special needs. It could be vice versa. It could be the child with no special needs is really making the child with special needs feel this way. But really, the diagnosis would be that the child is usually experiencing some kind of depression, adjustment difficulties, or anxiety usually. And you would see signs of it with withdrawal, or maybe a little bit of acting out, maybe some strange avoidance behaviors, refusal to participate in different activities. It could show up in many different ways. Yeah, it's kind of
Okay.
yeah.
All right. Do you see any role in your presentation tonight? Is there any role in here for educators in terms of these sibling problems? I mean, what if, you know, you have two sibs in the school and educators are seeing some tension between the siblings over the course of the school day?
Yeah, I mean, there's definitely a role for anyone interacting with these children, and schools are often the places that siblings spend a great deal of time together. So usually, sometimes siblings with special needs, without special needs, and with special needs are sometimes they're the same age, or in the same classes, or they're not in the same age, but they're in the same grade for whatever reason. So sometimes they have the same teachers. In that situation, the teachers could directly kind of help to intervene, to coach them on ways to manage their emotions, model, positive behavior to them. In a general sense, a lot of times the school counselor can get involved and talk to these children, particularly kids that don't have special needs, those siblings who might not really, have their own outside, therapist, or the school counselor could be a really good resource for that child to check in with once in a while, and maybe, just talk to them about how they're feeling and get a sense of what's going on. And sometimes, the school counselor could help, the two siblings to get together and work together and talk about issues. The school definitely plays a big role, and administrators in schools as well play a big role in ensuring that these siblings their needs are met.
Okay. Are you aware of any studies that have looked at problems between siblings when one of the sibs are boys or girls, or the youngest, oldest, middle, or anything like that? Is there any work being done in that area that you're aware of?
So you're asking if there are studies about siblings, one has a special need, one doesn't, or?
Yeah, but whether they're the oldest or the youngest or the middle, or whether they're what the sex is, is there any evidence that any of that plays any kind of a role, I guess?
Yeah, so some of the research
asking.
out there, there's been a good amount of studies in this area, and like that, that's why I talked mostly about the meta-analysis in this, which summarizes all the studies, because this webinar is not really the place to go over every specific study, but so some findings on ages and sexes are, like I pointed out before, boys tend to have a unique situation where sometimes if there's a history of aggression, they tend to be involved in acting out behaviors if there's a high level of warmth. So if the boys get along, usually if there's a history of aggression in the family or in the kids, that that's a relationship. The boys tend to have more of that, the physical acting out. The girls tend to be involved more in the caretaker role when they have a sibling with special needs than the boy, so they might help out, be like the surrogate mother. So there's definitely some findings like that out there. And off the top of my head, I can't tell you a specific study that I know addresses gender, but a lot of the research out there looks at general patterns in these, because there's a lot of variables. There's different disabilities, so studies will look at Down syndrome, autism, and diabetes, for example, and then compare it to a group that has no disability. And then in that study, they might look at gender, they might not. So there are findings out there, but most of the findings are relatively consistent with the fact that regardless of sex, warmth is important. More warmth is less conflict for both boys and girls in most cases. Less conflict is better for everybody, and the less differential treatment, the better. They do find that with age, that siblings raised that have more of a gap in age tend to get along better in most cases, not all cases, but so that's something about age, that siblings closer in age tend to have more conflict.
Mm-hmm. Okay, and we've gone a little over. I've got one more question. This has to do with a family situation where the grandparents seem to favor the child with the medical disability at the expense of the siblings. And apparently they've tried to discuss this with the grandparents, but they don't seem to get it, and they seem to not understand the problems that it's causing. So could you talk about that for a minute?
I mean, yeah, that sounds like a very frustrating situation. I actually hear that quite often, where there's, and and a lot of times with grandparents actually. So that's relatively common. But my best advice is to try some way to get through to the grandparents. I mean, it's hard to change people, you know, and you know, convincing someone that they need to spend more time with someone else. It's maybe, you know, maybe, I don't know if there's been like a formal sit down where the grandparents have been spoken to about it, or and said, look, you know, the other siblings really, they want to spend more time with you. One thing the parents might do is just try to schedule time with the other siblings, with the grandparents, so that the grandparents, if they're not gonna get on board with talking to them, maybe just set up the schedule so that they spend more time with the other grandkids. So you kind of force it on them.
Yeah,
That could be something to try. Not forcing it, but you're basically saying, okay, we're not going to talk about it. We're just going to schedule it so you're spending more time with this group than the other group. It's just one strategy if you're having a lot of trouble. Or you could have the siblings without special needs, you know, tell the grandparents how they feel. If it's appropriate, it might or might not be appropriate. I don't know the situation, but those are great questions.
No, there wasn't a lot of information provided here. Okay, I think we're going to wrap it up here. Thank you very much for your presentation, and I'm going to turn it back over to Kelly to wrap things up. Thank you.
Thank you for joining our webinar on sibling issues. There is an exit survey which we need everyone attending to fill out. The webinar blog is open now and available for the next 7 days on the NJCTS website for any additional questions that were not covered in tonight's presentation. That website is www.njcts.org. Also, an archived recording of tonight's webinar will be posted to the site. Our next presentation, The Life Cycle of Tics, will be presented by Dr. Michael Rubenstein and is scheduled for February 15th, 2017. This ends tonight's webinar. Thank you, Dr. Hartke, for your presentation, and thank you everyone for attending. Good night.